We're going to jump straight into our first presentation today, and I'd like to welcome and thank Dr. Hayley Pearson for her time. We're going to get an update on JEV, African swine fever and foot and mouth disease, and look at the current responses and surveillance in North Australia to address these biosecurity risks. Thank you, Hayley.
Thanks, Ricky, and also Heather and Narelle, and hello to everybody from Larrakia country up in Darwin as well. So as Ricky mentioned, yes, we're talking about Japanese encephalitis, African swine fever and foot and mouth disease. I may shorten African swine fever and foot and mouth to their acronyms ASF and FMD because they're a mouthful. Can I grab the next slide, please? Yep. Yeah, so the presentation today will be going through what Japanese encephalitis virus is, what the current situation is in Australia, and also more specifically in the Northern Territory, where feral pigs have been playing a fairly big role in the outbreak and in our response, as well as what surveillance we're undertaking and how critical NAQS, the Northern Australia Quarantine Strategy, has been to our surveillance up here, and the management approaches that we're taking at the moment. And then we'll be doing a short overview of African swine fever and foot and mouth disease, the preparedness and surveillance that is in place for these lurkers off the coast of Australia. And then we'll do a little brief overview of future actions and surveillance. Thank you. Next slide. Right, so Japanese encephalitis virus. For those who don't know about this, I'm going to give you a brief overview. Some may know a fair bit about it already. It's a mosquito-borne virus. So that means it's transmitted from mosquitoes to multiple different hosts, and it can cause reproductive losses in pigs. But it can cause brain swelling and a variety of different unpleasant symptoms in humans, as well as horses, and in rare cases can lead to death. So it was found across most of Asia and Western Pacific, and it was first detected in mainland Australia in February 2022. And since this detection down south, the Australian Government Health and Agricultural Departments have been working together closely with their state government counterparts to respond to this within the animal industries, as well as within health, to ensure that there's been a swift and coordinated response to the outbreak. And it's not known how the virus made it to the mainland. So there's just been a couple of thoughts that perhaps it was from windblown mosquitoes or potentially migrating birds. But this transmission cycle just shows that there is a natural reservoir, water birds, so they believe are day birds, so things like herons and egrets may be the natural reservoir. So, but there's been quite a bit of research done, there's quite a bit of research planned to see whether there are other potential bird reservoirs for this. And then down the bottom, you can see the amplifying cycle. So pigs are an amplifier for the virus. So that means if a mosquito was to bite an infected mosquito was to bite and infect a pig, then that pig would be able to essentially produce a lot of virus within its body, enough to then transmit it to majority of the other mosquitoes that bites it, and then those mosquitoes could fly off and bite any other hosts. There are other animals that don't necessarily exhibit symptoms, so cattle, dogs, sheep and goats, and again they're all dead-end hosts, so they can't transmit it to each other, they can't transmit it to us, they can't transmit it to the mosquito. So the risk of contracting Japanese encephalitis comes directly from the mosquito, so a human cannot transmit it to another human. Thank you. Next slide. So globally, there's around about 70,000 cases of this virus per year, and of those who do exhibit symptoms, there's a 10 to 30% mortality rate. So that mortality rate sounds scary, but majority of people who do get bitten and infected by a mosquito don't ever know that they've had it. So it's only those who start exhibiting symptoms and do get unwell that this mortality rate applies. And in another 30%, there is the potential for long-term impairment, so neurological damage that is sustained potentially for life. In the Australasia area, there's around about 20 or more mosquito-transmitted flaviviruses. So this Japanese encephalitis is a flavivirus. It's within that group of viruses. And it's present across Southeast and Southern Asia, and there are seasonal incursions into the Torres Strait. Thank you. Next slide. Right, so this slide is just showing what has happened in Australia up to December 2020. So this is what has happened historically. So in 1995, there were 3 cases, 3 human cases, 2 of which were fatal for Japanese encephalitis on the Tiwi Islands in the Torres Strait. And also sentinel pigs were infected on other Torres Strait islands during this minor incursion. And then in 1998, there was 1 case from Tiwi Island and one mainland case around Cape York area, and also pigs seroconverted. And then in 2000 and 2002, there was a different genotype incursion. And there were sentinel pigs and mosquito traps during that incursion as well. So that's what's happened in Australia up to this point. And those outbreaks, it was sort of suspected that it was mosquitoes that have potentially blown in that were infected, or potentially migratory birds that were infected that brought it in with them. Next slide, please. Right, so this is just showing the chronology of recent events in Australia. So up here in the Northern Territory, a woman her 45-year-old woman got sick in February of 2021 and 15 days later passed away. And it wasn't until June that they were able to diagnose her with Japanese encephalitis. So up here in the Northern Territory, there has been a response in place to try and conduct surveillance to see whether there was any Japanese encephalitis in animals up here. And we did identify serological evidence of past infection in 3 sentinel cattle and 1 feral pig from NAQS samples. Now, the problem with the serology is that because it's a flavivirus, they're all quite related. So it was possible that it was a cross reaction. So we couldn't definitively say that, yes, Japanese encephalitis is here. We couldn't definitively say that this wasn't just one mosquito that unfortunately reached this one woman. So on the 25th of February in 2022, there was a confirmed diagnosis of Japanese encephalitis virus in a Victorian piggery, and it was determined to be genotype 4, which is the same as what the woman up here in the Tiwi Islands had. And then very quickly, the very next day, there were a number of piggeries in New South Wales, as well as a piggery in Queensland that also had reproductive loss, and it was determined to be Japanese encephalitis virus. In response to this, on the 4th of March, the Australian Acting Chief Medical Officer, Dr. Sonia Bennett, declared the unfolding situation a communicable disease incident of national significance. And then since then, on the 11th of March, they have isolated the virus from mosquitoes in Victoria. Not many mosquitoes, majority of the isolations have been from pigs. And then on the 15th of March, we detected we had our first detection, a PCR detection. So that means we were able to isolate the virus from a feral pig up here in the Northern Territory. Can you go to the next slide, please? So currently in Australia, there are 42 human cases of Japanese encephalitis virus across New South Wales, Queensland, South Australia and Victoria. And they believe majority of those cases may have actually been contracted from a recreational activity, so people who have been camping along rivers as opposed to people who were in and working in infected piggeries, unless the people had passed close to those piggeries. But at the moment, they're sort of linking those outbreaks to potential recreational activities. And then as of the 18th of May, there's 79 infected premises, all of those are piggeries. Those infection rates have slowed down significantly since the colder weather. Up here in the Northern Territory, as of today, actually, we've had 35 feral pigs detected with active infection. So that means we've had PCR detection of those virus in 35 feral pigs across 5 different local government areas. If you could go to the next slide, please. So that's the 5 local government areas. So we've got the Tiwi Islands up the top. We've detected it in a feral pig there. And then we also have a number of different local government areas around the Darwin, Palmerston area. Yes, so one of those local government areas is quite large. So at the moment, the positives are towards the top end, not down towards the Western Australia border like that map indicates. And we're just presenting it as a local government area map because that's how majority of the other states have been presenting their information, and it just protects the privacy of any properties where those feral pigs may have actually been collected from. Thank you. Next slide. So we've been conducting a lot of surveillance, and majority of the great work has been done by NAQS, and I will hand over to Skye in just a moment. We have been conducting surveillance in domestic pigs in the Northern Territory. There is no commercial pork industry up here, so I want to make that clear from the beginning. There's no commercial industries, so we're relying on people voluntarily allowing us to come in and take samples from their essentially pet or backyard pigs, a lot of which are only 1 or 2 generations different from the feral variants, some of which were actually collected as piglets from the wild. So we have contacted these people via the property identification codes, and we've just offered this free voluntary service. So we have visited a number of properties and sampled there, but the numbers from that sampling are very, very low. So we are very reliant on this surveillance in feral pigs to give us an idea of how far this Japanese encephalitis virus is spread. Next slide. And this is just showing the kind of country that the feral pigs have to be, where the feral pigs are found and where they have to be collected from. Next slide, please. And so I'm going to, I will just say, as well as the domestic pig sampling, we also have sentinel animals up here. So we've got some pigs and chickens spread across the Northern Territory. Sorry, not pigs, my apologies. We have some cattle and chickens spread across the Northern Territory. They are not as sensitive as pigs for Japanese encephalitis, for showing Japanese encephalitis results. So we are still quite set on gaining more information from pigs in those areas. I'm going to pass off to Skye now because she will have more information about the Northern Australia quarantine strategy and what they do.
No worries. Thank you, Hayley. Yeah, I'm just going to digress a little bit, just give a bit of context about the NAQS program, which I work for, and then I'll hand back to Hayley to carry on with the disease discussion for JE and FMD and ASF. So the NAQS program is based in the north of Australia. This map here is really just showing the sort of area where we operate. Traditionally, we focused on coastal areas of the north. We do also work a little bit inland. The program was established more than 30 years ago when it was sort of publicly recognised that we have some unique biosecurity risks in the north. We've got neighbours to our north with pests and diseases that are not present in Australia, and the opportunity for those pests and diseases to get into our country through monsoonal winds, tides, natural pathways is the term that we use in the program. And in the context of Northern Australia, for those who don't live and work up here and perhaps less familiar, it's an enormous area, sparsely populated, huge coastlines. Being able to detect disease early is challenging. And so that was why NAQS was established, and those drivers for NAQS being established are still present today, and if anything, increasing. Okay, we've moved on. Never mind. Yeah, I'm based up in Cairns. My team is spread out all across the north. I manage the animal team. There are plant teams as well within NAQS, and also a team dedicated to working with Indigenous rangers who also work across the north. in collaboration with us. So my team, I have vets based in Broome, Darwin, Katherine, Cairns, and temporarily the Sunshine Coast. And we operate all across that area. We do a number of different surveillance programs, but I guess the one that's probably of most interest to this cohort is our feral animal surveillance. This involves our teams going up and doing low altitude observations from a helicopter, and then feral animals across a range of different species, destructively sampled. So they're shot, we land, we conduct thorough postmortems, collect samples, do routine disease exclusions for some exotic diseases we're interested in. And then if we find anything unusual during those postmortems, we'll also submit those samples for further work up at the government labs. And so NAQS has a long history with JE. JE, as Hayley mentioned, was first detected in the Torres Strait more than 2 decades ago, back in 1995, and NAQS was called in to assist with that response. Besides our surveillance team, we also have a team living and working in the Torres Strait. They manage the regulatory side of our work throughout the Torres Strait. There are biosecurity regulations restricting movement of biosecurity risk products in the Torres Strait. And our team up there were called in to assist along with our vets. So surveillance was done from the animal side by NAQS in collaboration with BQ, Biosecurity Queensland, along with Queensland Health. And following that initial response, an ongoing monitoring program has been set up, which is led by Queensland Health, and NAQS collaborates on that. So we conduct monitoring in the Northern Peninsula area for Japanese encephalitis. We also test animals opportunistically up in the Northern Peninsula area, very tip of the Cape, and throughout the Torres Strait when we're doing our other surveillance activities. As Hayley alluded to, that JE is a tricky disease to find from a surveillance perspective. It's hard to find on samples. So even if you collect samples regularly from mosquito traps or from various different species of animals, you're not necessarily going to find it even if it was there. Serology is tricky, as Hayley mentioned, and finding the actual virus is also really tricky because it's often not found in blood, which is the standard sort of sample that most people will collect. When the more recent cases occurred, so sort of mid-2021, when we had that one human case in NT, we were called in to assist with the response from the animal side, particularly looking for the disease in feral hosts. And we conducted some surveillance at the time and were unable to find it. It was the end of the monsoon season, so not that many mozzies around, and perhaps not that surprising. Since the outbreak kicked off properly in the southern states, obviously a lot more interest in surveillance really ramped up, and we also ramped up our feral surveillance in the NT. So we've been conducting extra surveys on top of what we normally would, and we've started testing for Japanese encephalitis to support the NT government response. Just for context, we're also doing similar work in Queensland and WA, but just focusing on NT today, given Hayley's presenting. And NT is where we found it to date. So I guess we don't know the future. We may still find it in other states, but we've found it in quite a lot of pigs now in NT, which I guess has confirmed what we suspected. And we've also confirmed what we suspected in terms of it being a really difficult disease to find from a surveillance perspective. So we've had to get some less traditional samples to manage to find it. So particularly tonsillar tissue is where we're having the best results. So I guess the program is, you can, sorry, move to the next slide, Narelle. The work we're doing is ongoing. It's a response, so it's evolving. We are now working with each of the jurisdictions in the north where we operate to sort of look at what the priorities are moving forward. The mosquito season. So most of the risk, I guess, perhaps in the southern states is dissipating now that it's going into winter, but in the north we've still got plenty of mozzies around, and potentially still an ongoing risk of JE if it is indeed present. It's also the area where endemic flaviviruses are known to circulate, which does complicate surveillance and diagnostics as well. I'm happy to answer any questions at the end, but in the interest of time, I'll just hand back to you, Hayley, to carry on with the work on JE and then the other diseases.
Yeah. Thanks, Skye. Next slide, please. Yeah, I thought I'd just finish on what kind of management options are available to us, so that you're not left on a negative note about this virus, so that everybody has a bit of information to arm themselves with. So up here in the Northern Territory, there's a medical entomology team who are underneath the Northern Territory Health banner, and they've been doing quite a lot of vector control. So a lot of spraying to try and reduce some of those mosquito populations in the areas where there's a lot of water and where there are the amplifiers and the reservoirs. Next one. Next, please. Yeah. There's also a lot of public information campaigns going ahead. So that's to help people identify how to protect themselves. So essentially mosquito repellents, so choosing the effective repellents with DEET, for example, as well as, you know, long clothing, light colours, things like that. And then Northern Territory Health and the Chief Health Officer, CDC, etc., are all working together to put together a vaccination strategy. They've also included, you know, us from the Department of Industry, Tourism and Trade and NAQS in a lot of these meetings to identify risk groups, considering the vaccination isn't available in significant numbers in Australia, but it is a vaccination that was established decades ago. But yeah, as I said, there's just not a huge amount of supply in Australia at this time. I believe 140,000 doses recently arrived in Australia. So there's some discussion about, you know, how many of those vaccinations each jurisdiction will be getting. Next picture. And then the other option is to potentially reduce feral pig population. And of course, we know that eradication isn't possible. So it would be things like strategic depopulation, potentially around inhabited areas where there are people. So that's just something that's up for discussion at the moment within our groups. And we will be, I think we're meeting next Wednesday to sort of confirm how we can move ahead with that. But it will involve a lot of collaboration between government departments as well as landowners. Next slide, please. Yep, the next one, yeah. Okay, so before we finish, I think I've got a couple of minutes. I was going to talk about African swine fever, so ASF from now on. So it's a fatal viral disease of pigs, so it only infects pigs. And there have been no reported cases of ASF in Australia. However, there have been outbreaks in a lot of places around the world, and it has spread throughout Southeast Asia. And there's confirmed cases in a number of countries, including Timor-Leste and Indonesia. So it has moved quite close to the Australian border. The next slide, please. So the clinical signs, which is good for everybody to know if you're going to be out in those situations where you're interfacing with feral pigs, probably things like feral pigs that are in particularly poor condition may have signs of diarrhea, but the superficial and internal hemorrhages are probably the big giveaway for ASF. But Heather mentioned that there are fact sheets on these diseases, so it would probably be good for everybody to familiarise yourselves with what it looks like, so that if you are out in the field, you can be the eyes and ears for this disease and report it to the emergency animal disease hotlines within your jurisdiction. Next slide, please. So surveillance for ASF is really, really reliant on these forms of, we call it passive surveillance. So we're really reliant on people who are out in the field who are interacting with feral pigs or who work with domestic pigs to see the signs and report it. So we rely on passive surveillance because, as Skye was talking about, it's really difficult to go out and target a population of animals and then just sample for a specific disease. For early entry into the country, we'd imagine that the prevalence of the disease would be very, very extraordinarily low to begin with. So the chances of selecting the right population to sample at the right time and selecting enough of those animals to find the disease it's a pretty low chance. So we are quite reliant on passive surveillance. And as I mentioned, so NAQS are critical to this surveillance. Next slide, please. And then onto foot and mouth disease. Again, Heather mentioned that there's an information sheet on this disease as well. So it's a highly contagious viral disease that can infect all cloven-hooved animals. So that includes cattle, water buffalo, sheep, goats, pigs, etc. The list goes on. And it's mainly transmitted through direct contact, through infected water, fomites, all of those kind of things. So long distance transmission for ASF and FMD are often a result of human movement. So people accidentally getting it on their boots or moving animals between locations. So that normally causes the big jumps in the movement of the disease within a location. So with foot and mouth disease, it's estimated that the impact of an outbreak in Australia would cost our economy up to 52 billion. I think they've even estimated that it's higher than that now over a 10-year period. And then even a small outbreak scenario lasting just around about 3 months has been estimated to cost 5 to 6 billion, because it would essentially shut down all export of livestock except for maybe poultry. Next slide, please. So again, clinical signs are critical for everybody to know. So we're talking about blisters and lesions on the feet and the mouth, drooling, limping, lethargic. So a clearly unhappy, uncomfortable animal. That's the kind of signs that we're looking out for when we're out in the field, if we're in contact with feral pigs. But with this disease, it's also not just feral pigs. It's, as I mentioned, all cloven-hooved animals. Next slide, please. And so foot and mouth disease has reached Indonesia. There's been quite a number of outbreaks there. So we have to also focus on surveillance for this, for early detection. And as with ASF, passive surveillance is the most effective means. We are able to utilise passive surveillance from our commercial industry up here, so our cattle industry. We will be relying on producers to report anything that they see, any of these signs that they might be seeing in animals, as well as animal health people. NAQS, again, is very significant in the role of surveillance for FMD, and basically any people that are interacting with animals. Thank you. Next slide. And so I just wanted to finish on future actions and surveillance. So next slide, this will be the last one. So in terms of future actions, we do support strategic depopulation, particularly because it's not just in response to Japanese encephalitis virus. There is significant biosecurity risk across the coastline, across the top end, for a number of different diseases that are quite close to Australia now. So we'd be, so there is collaboration that is required to undertake this work, particularly between agricultural and environmental agencies and landowners. And we would be interested in looking into enhanced surveillance opportunities for emergency animal disease. So screening tests, the use of accredited providers and trained pig hunters. So as I mentioned before, the majority of long distance movement of these diseases is by people moving it. So that's where the training and accreditation is quite critical in these situations, to make sure that we're not accidentally moving the disease around. And in terms of Japanese encephalitis virus, we're concerned about the risk to people with that one. So if you're out in the environment with the pig, the amplifier, and of course there will likely be mosquitoes out there as well, we're quite concerned about the risk to people. And that's where the human vaccination comes in. So we also see an opportunity for a project under the National Feral Pig Action Plan. So we would be interested in forming the national guidelines for point of care testing. So that means tests that can be taken out into the field that are resistant to the environmental conditions, that may not need refrigeration immediately. So there are a number of different tests, particularly for African swine fever that I know of. And then we'd be interested in training and accreditation for feral pig stakeholders, so that we can be utilising this, the valuable resource of people like this out in the field, and using them to get samples potentially for some of these emergency animal diseases. And then Also, we'd be interested in testing apps, so things like feral scan, so that there can be contribution to reporting where feral pigs are found and whether any suspicious symptoms or things like that are identified while they're out there, as well as diagnostics and reporting systems. So there's quite a fair bit of collaborative work that can be undertaken there. Thank you. Last slide. Yeah. So thank you very much. I understand questions will be held to the end, so I'm happy to take all questions then. Thank you.
Thanks very much, Hayley and Skye, for that update